Muscle energy technique is a manual therapy method widely used in physiotherapy, osteopathy, and rehabilitation to treat musculoskeletal dysfunctions. It is an active technique in which the patient voluntarily contracts specific muscles against a controlled resistance applied by the therapist. The technique works on neurophysiological principles such as post-isometric relaxation and reciprocal inhibition to reduce muscle tightness and joint restriction. Muscle energy technique helps improve joint mobility, increase range of motion, decrease pain, and restore normal muscle length. It is commonly applied in conditions like neck pain, low back pain, muscle spasm, postural imbalance, and sports injuries. The therapist positions the joint at the point of restriction, asks the patient to perform a gentle contraction for a few seconds, and then moves the joint to a new barrier after relaxation. This process is repeated to achieve therapeutic benefits. Muscle energy technique is safe, precise, and patient-controlled, making it suitable for both acute and chronic conditions.